IV insertion video, take one. My name is Megan Jones, and this is Tanya, and Stephen is videotaping for us. And we're going to simulate the proper way to insert an IV. First thing you want to do is knock on your patient's door and enter the room and say, "Hello, Mr. Brooks. My name is Megan Jones, and I'm going to be inserting an IV in you today. Can I get you to say your name and clinic number for me, please?"
Taylor Brooks, and it's me.
Thank you very much. Now I just want to explain what we're going to do for you today. We're going to, and always when you enter the room you hand sanitize. I want to just identify the patient, and then I also want to identify whether or not the patient has any allergies. And there is no tag for allergies, and I of course will ask the patient as well. Are you aware of any allergies that you have?
Nope, I'm good to go.
Alright, now I'm going to just explain the procedure a little bit to you. What we're going to be doing is we're going to be inserting a peripheral IV, and the reason why we're doing this is so that we have access to the vein, which will allow us to supply you with fluids if necessary, medications if necessary, and we can do small blood draws, and it's just going to limit the number of times that you will need to be poked, because we'll just have this one access open. So I'm going to go gather my materials, and I will be back and we will get started. And then you leave the room, hand sanitize, and then leave the room. And then here I have all my materials on the table that I have cleaned off with Oxavir wipes. So we have cleaned off the area. The tray table is most likely what we would be using. I have my gloves, my tourniquet, alcohol wipes, my flush, my lock, and my needle, and a Tegaderm to place over once I've completed. And I have two pieces of tape that I'm just going to dangle down on the side of the tray table after I've wiped it down, so that I can use them to hold the IV in place after I've inserted it. So what I'm going to do first is I'm going to assess the site and apply my gloves. So I want to just, I'm back in the room. "Hi, Mr. Brooks, I'm here. I have all my materials, so we're just going to go ahead and get started. I just need to take a look at your arm and kind of see where I would do it at, and I am assessing the site, and it's clean. There are no bruises, there's no hematoma, there's no sign of any damage to the skin, so this looks like a good area to probe for insertion. So I'm going to put on my gloves, and Mr. Brooks, I'm just going to go ahead and apply this tourniquet, and what this is going to do is it's going to make your veins kind of bulge out a little bit so that I can make sure to get a good one and get this in on my first try, because I am a pro, and that's what we do. So I'm going to untie it while I get my supplies ready, because you can only leave the tourniquet on for no longer than 5 minutes. That is the maximum, and you of course don't want to leave it on for that long if you don't have to. So I'm going to alcohol off the arm. And I've kind of got my spot. You look like you've been poked once or twice before, Mr. Brooks.
More times than you can believe.
So we clean it off really good, and you want to do this for, I don't know, I'd say approximately 15 seconds or so, until it's good and clean, and then we throw that out. And now I'm going to get this ready first. I'm going to get this ready first, and then I will reapply the tourniquet just to get that vein good and ready again. But what I need to do is you need to flush out this to get fluid saline all the way through here, just to make sure that there are no holes, and just to get it prepped so that it is all ready for when you insert it. And I am hand sanitizing in between each step that I do here. And you want to do that outside or away from the patient, not towards the patient. And another good thing to do when you're prepping is you want to make sure to have a trash can handy. It's really nice to have a garbage right there. So I'm just going to push this through until fluid or saline goes all the way down, which it did just fine, and then I'm just going to set this over here and set it aside for a second. I'm actually going to take it out of the package and put it on my clean surface and throw that away. Hand sanitize, because you can never hand sanitize enough. So now we're going to get the needle ready, and what I'm going to do now is I'm just going to kind of open it up. And you want to, of course, check the gauge and make sure that you have the proper size needle and all the appropriate materials beforehand. So I'm going to put on my gloves. And I'm going to apply the tourniquet. Alright, and I'm just going to alcohol this off again because I was breathing heavy and I just want to make sure it's nice and clean. So we have that alcohol off. And now I'm going to take my needle out and now, when you insert the needle into the arm, you want to make sure to have the bevel up. And you can tell because it'll look as though the little hole is facing upward. And so now I've had my tourniquet on for a little bit, so I want to make sure to feel. And then you're going to feel, you kind of want to go in at an angle. You're going to feel a little poke. And we're in. And you can tell that we're in because we're seeing fluid, blood, return. So you want to get that, oops, oh, I didn't take out the needle. So you don't want to do that. That was just, you want to take out the needle. You want to hold this down in place after you've seen the blood return and you know that you have the needle where it needs to be. And then you take off the tourniquet, right, because you don't want to increase the blood flow out there. So then we take out the needle. And then we insert that. And after we have that done, you want to pull back a little bit just until you see blood, and then you're going to go ahead and just flush this through. So I'm going to watch how much I'm flushing through, and I'm just going to flush through 2 because that's plenty. So I'm going to put the lock on. And then I'm going to just go ahead and grab an alcohol wipe and clean him up a little bit because we had a little bit of some blood spill, which is perfectly normal. That happens to even us pros. And I'm going to make sure to put the needle in the sharps. And now what I want to do is I want to get the Tegaderm on. And since I have no blood or no fluids on my hands, I'm going to keep my gloves on. Had I gotten any blood or any fluids on my hands, I would have taken them off, hand sanitized, and then placed new gloves on. And these tricky little guys, what we're going to do is put them on the clean table. And before I get that open, what I'm going to do is I'm going to unlock this, and I'm actually going to pull it down a little bit. Because and now that I have that locked and flushed and everything else, I can just go ahead and remove this, which I will also place in the sharps. So, now, you want to make sure to get this. This just doesn't seem right. I do this right? Yeah. Okay. Now you just want to make sure to get this so that the slits go on each side. And you want to make sure to have the spot of insertion visible, which it is right there. We have the nice tegaderm right over it. And then what we will do is we will take off our gloves because we really don't need them on at this point. We will write down on this handy dandy little thing the date of insertion. We're just going to go ahead and take this off though. Make sure that's pressed down. I'm going to grab this and do one underneath.
Otherwise you could.
And then one over. And then, if I had a pen handy right here, which I do, I would just go ahead and write today's date, which is September 8th, 2011, and I might even just put the day that it's a Thursday on there too, just so that it's there. And then I'm going to loop this around. And I'm just going to put one more piece of tape over there to hold it in place. And then clean up my area, put these in the sharps. And then say, Mr. Taylor Brooks, you have been just a wonderful patient. The tape is secure, everything seems to be in place. And you know what, I might even just do one more. Since this is going right on the tegaderm and not on the patient's arm, this little bit of security, extra little bit of security isn't going to hurt the patient any. So, Mr. Brooks, how are you doing?
Oh, fine, just good.
That was, I hope, very quick and painless. And so...
That was the best IV insertion ever.
Well, thank you very much. And I just want to assess the site one more time just to make sure that there's no, bruising or blood swelling up or hematoma that's forming there. And there is not. It looks as though this is just a perfect portal for medications and saline and whatever else needs to be put in there. That's, of course, prescribed by the doctor, and we would check doctor's orders. And if the doctor ordered some saline to be hung right away, that's what we would do. And we would leave Mr. Brooks in a very comfortable position with the call light close to him, and we would say thank you for your time. And then I would document. I would document and document exactly what I did. I would document the gauge of the needle, the date of insertion, the site area. I would, just document everything you can. And then I would tell the patient my joke, which is really hilarious. So, did you hear about the guy who ran into the IV insertion clinic?
No, I did not.
He got stuck.
Oh,
But, there's my joke. And that concludes this IV insertion.